Israel immediately became a world leader when it comes to COVID-19 vaccinations, managing to fully vaccinate 50% of its 9 million plus population in just 3 months. And how would you describe the handling of the rollout?
Excellent.
While Israel's rollout has been extremely successful, there has been some criticism towards the country's vaccine deal made with Pfizer.
In March, Israel signed a deal with Pfizer, and it basically turned Israel into a huge nationwide phase 4 lab to test the Pfizer vaccine.
The deal, which was brokered by former Prime Minister Benjamin Netanyahu, has come under scrutiny.
Under emergency regulations, Netanyahu was able to classify what is a deal made basically between the state and this private company, and it shouldn't be kept secret. So there are a lot of lawsuits now to open it.
Included in the classified information is the price Netanyahu paid for the vaccines.
I can tell you that it's estimated to be around, at that time, $34 per dose.
However, many have also praised the efforts of Netanyahu, including Pfizer CEO Albert Bourla. Bourla praised Netanyahu and said it was the former Prime Minister's obsessive efforts that got Israel the deal. Despite the slight controversy, Israel has marched ahead with its program.
The vaccine rollout in Israel, the first vaccine rollout, started in December. It wasn't the government doing the rollout. It was these health management organizations that really are the backbone of the healthcare system of the country. GPs have nothing to do with it. Yeah, no doctor vaccinates you at all. Everyone just would get a text when their age group came up, or if they had a special medical condition or whatever, you would get a text message from your HMO saying, it's your turn. Please press on this link to make your appointment to come get your vaccine. Israel started a policy of not throwing away any doses that weren't used up at the end of the day. And so what started happening pretty organically is that people would show up at their HMO's largest nearby clinic and just stand in line at the end of the day. The number of people severely ill is going down after going steeply up, and Israeli doctors believe this is thanks to the booster shots. In other words, that the Pfizer vaccines wane after about 5 months. Now, because so many people have already gotten the booster, so now they have these like little trucks that are going from school to school, so children can get the vaccines at school. Israel's a country of 9.2 million people, or 9.3, and has 11,000 infections a day. In absolute numbers, Israel's vaccination rate is something like, I think, 65 or 67%.
The first COVID-19 vaccination administered in the United States took place on Monday the 14th of December 2020 in New York. Since then, 61% of the eligible population has received at least one vaccine dose. There are 3 vaccines authorised for use in the US: the Pfizer, Moderna and Johnson & Johnson vaccines. Of those vaccines, Pfizer has recently been FDA approved. The country will also soon allow individuals to receive a vaccine booster dose 8 months after they receive their second dose. According to the CDC, the vaccines are doing exactly what they were designed to do: prevent serious illness, hospitalisations and death. However, the Delta variant is proving to be extremely stubborn, with health experts seeing reduced protection against mild and moderate forms of the disease. This is where the booster shot will come into great effect. By the 14th of August 2020, months before the first vaccine dose would be administered outside of clinical trials, the UK government had secured deals with 6 different pharmaceutical companies. Combined from these 6 companies was a stockpile of 340 million vaccine doses. The UK currently has 64% of its population fully vaxxed and 72% having received at least one dose.
One of the reasons, Minister, they're saying wait is because you and the Prime Minister told them that. You said there's no rush for weeks and weeks.
It's not a race. It's not a competition.
You said there's no rush.
It's not a race.
We talked about it on this program.
That's false. It's not a race. It's not a competition.
The Prime Minister has been accused of being complacent.
A lack of supply is threatening to slow the second phase of Australia's vaccine rollout.
We've had our challenges with this program. We've had significant challenges with this program.
Now, some don't like to see this as a race, but a race it surely is.
Australia's vaccine rollout began in March, but struggled to pick up steam due to a variety of factors, with many target deadlines being missed or pushed back.
Those comments were made at a time when we were talking about the approval of those vaccines by the official bodies here in Australia. That we had low rates of COVID at the time, and the view was by Professor Brendan Murphy and many others that those agencies had to do their job, and we had to get the rollout occurring in the most effective way to target those in the older age groups. And so we were prioritising where those vaccines in the early phases needed to go. Those comments were made back in March, and I mean clearly the situation has changed since that time, and that's why we've been ramping things up.
The main reason why we are so far behind countries like the US, countries like the UK, is because of lack of supply.
Part of the reason for the slow beginning to Australia's rollout was the changing of advice from the Australian Technical Advisory Group on immunisations, after cases of blood clotting began to arise after people had received their vaccine overseas. The medical body recommended AstraZeneca only be administered to those aged above 50. Then again adjusted their recommendations to the government to only give the vaccine to anyone above 60.
We needed to have more vaccines available. We needed to have contracts locked into last year so that we had more opportunity for Australians to access vaccines.
So I got AstraZeneca because I'm a nursing student, and to go on placement back in May, they didn't have the Pfizer, so we had to get the AstraZeneca. I would prefer Pfizer with all the buzz going around with blood clots and all of that. But I did talk to my GP, but he was like, that's not a big difference, honestly. It's a vaccine at the end of the day.
In recent weeks, Victoria, among other states, have opened up appointments for people over the age of 18 to get the AstraZeneca vaccine. This in an attempt to limit the number of doses going to waste.
Huge uptake. Yeah, there's been a lot of young people coming in to have their vaccinations.
Another shortcoming of the federal government's vaccine rollout has been their inability to get enough First Nations people vaccinated.
Look at how we're treating First Nations people in our country. It's horrifying to think what could happen if COVID breaks out in a big way. It's starting to, and that's really alarming, in our Indigenous populations. In years to come, we'll be condemned for how we've treated our First Nations people.
However, after a tumultuous start, the rollout is beginning to hit its stride, with 16 to 39-year-olds now able to receive the Pfizer jab. Australia is vaccinating nearly 2 million people a week.
I feel like people, when there's an outbreak, think it's better to have something than nothing. Even before they opened up Pfizer, a lot of people came in the last couple of weeks and had AstraZeneca in that age group.
We've got the supply, we've got the distribution networks now. We've now got more than about 9,400 places people can go to get vaccinated. We intend over the next couple of weeks to make that more than 10,000. So really it all just does come down now to people turning up.
The government has created a national plan based off of the Doherty Institute's modelling that will see Australian lives return to as normal as possible when vaccination rates hit 70 and 80%.
The national plan we have developed and agreed is our pathway to living with this virus.
In more positive news for Australia's rollout, the government recently secured multiple deals to get more doses onshore.
The government has been able to secure with the government of the United Kingdom a Pfizer swap deal, which will see 4 million doses of Pfizer come to Australia this month.
Playing a huge role in that rollout is pharmacies right across the country.
So community pharmacies, much like medical centres, are part of the national rollout strategy, and the Commonwealth Department of Health in Canberra coordinate for their wholesalers to distribute the AstraZeneca vaccine, or soon the Moderna vaccine, direct to pharmacies through their exclusive wholesaler. So the Moderna vaccine is an mRNA vaccine. It's basically equivalent to Pfizer in most ways. So for any medicine that you supply or administer, you're having a conversation about that consumer, about their individual circumstances. So from that point of view, the vaccine is no different, whether that's AstraZeneca for somebody under 60 or the annual flu shot. You're making sure that the person understands the benefits the vaccine will give. In this case, it means if you get COVID, you won't die, you're not going to go to hospital, or far less likely to. It means that you understand that there are multiple brands out there and that one's got a couple of side effects that the other doesn't. But overall, they're in outbreak situations such as what most of Eastern Australia's got at the moment. Getting a vaccine that works and is available is going to be nearly always the best option for most people, but there are some exceptions and we can explore that with you.
If vaccination rates keep high, Australia is on track to reach the 80% mark before Christmas.
My advice to anyone is get online and book your appointment.
Talk to your pharmacists and talk to your doctors and talk to your care team.
Go get vaccinated. And honestly, in my opinion, it doesn't matter whether it's Pfizer or AstraZeneca. At the end of the day, it's a vaccine and it's some sort of protection against any sort of COVID strain.
It's only a matter of time probably before we're all at risk, so you'd rather be protected if you could.
This Delta variant is hugely infectious, hugely. And so even if a tiny proportion of your population is unvaccinated, it spreads like wildfire.